hope is a strategy in this instance. We really are the experts of our bodies, and you will have to find a voice.
Hello, and welcome to the IGCS Voices of Hope Transformative Advocacy Series. Conversations with gynecologic cancer survivors who are turning their lived experience into influence. In this video, I'm speaking with Annie Grenier, a cervical cancer survivor who recently discovered the power of sharing her story. In our conversation, we'll use the public narrative framework, which is a leadership practice that uses storytelling to move people to action. As Annie reflects on her experiences and how they've shaped her, you'll see moments where ideas begin to spark. You'll hear a voice of hope. Hi, Annie. Thanks for joining us today for this episode of Voices of Hope. How are you?
I'm doing great. Hi, Debbie. It's great to meet you.
You too. Thank you so much for being willing to share your story. I know we're going to dive into a lot of things today, so let's go ahead and get into it.
Absolutely. Well, I know that I'm very early in my journey in wanting to become an advocate, but I'm really excited to share with you what I've done so far and my vision for the future. Giving a little background, pre my cancer, right? I was heavily involved. I worked within sales. I was very active, very outdoorsy, a runner. Cancer happened, right? 2020, life changes. My husband also gets cancer. So we're on the cancer journey together. So in these last 5 years, I've either been cancer caregiver, cancer patient caregiver, and we've been doing that throughout the journey. Sadly, a couple months ago, I lost my husband to his cancer. And as difficult as these last few months have been, I've been looking for hope within myself and outside to go, how can I turn a lifetime of cancer into something positive? There has to be a silver lining. And one of my pharmaceutical drug companies a couple months ago asked me to come and speak at one of their conferences. And that's really when the light bulb turned on that I can actually pay this forward and help, because I am very comfortable speaking out, speaking up, speaking for myself, speaking for others. And I'm like, why can't I harness that and do something with it? And I want to share just one other background about me, not to, share any more sadness, but it might make sense in regards to why cancer, I need to finally do something to fight against it. It has followed my entire life. I lost both my parents from cancer when I was 8 years old, 3 months apart. My sister currently has cancer. I lost a sister 8 years ago to breast cancer. It has just been a front row seat in my life for all of my life. And so it wasn't surprising when I got it. So I never said, why me? I was just like, oh, there you are. Now it's my turn. And so I never went through the anger part, but I always was looking for what is the reason for all of this? And if I can thread it to something finally positive. And when this opportunity showed up with my drug company, it was like, that makes sense. Now I can make sense for all of this darkness that still has a lot of light during it, and just turn it into something finally better.
That makes a lot of sense, Annie. And I think that vulnerability is so important to share. Let's hear a little bit about going back in time. So how did you get to where you are now? Early signs and symptoms, what was that like, your journey to detection?
Absolutely. Yeah, no, it's a long journey, but I can shorten it. I had started having symptoms in January of 2020. That was right before COVID lockdown. So, produced its own challenges as we were trying to navigate what was happening with me. But I was 10 years post my last period. I should not be having any bleeding. I was bleeding vaginally as well as bleeding in my urine. That just kept increasing prior to them being able to get me in. Once we did, I was diagnosed with stage 1B cervical cancer. So that meant to me, though, right, the B meant it's large enough that it's not microscopic. So we knew we had to do something. I had a radical hysterectomy. And then, so consequently, each year, almost to the date, I had a year later my first recurrence. We did radiations, chemo. A year later, it had metastasized. I did 4 treatments all at one time, chemos, immunotherapies. A year later, my tumors grew. That's when I went on the targeted therapy drug that I'm currently on. I've now had 44 rounds, and one of my tumors in my lower pelvic region is no longer there. I still have the one in my liver. I will always have cancer in me, so I will always be in some form of treatment. My treatment does not end. I go every 3 weeks, and that is indefinite. So my targeted therapy drug is my plan every 3 weeks for indefinitely.
Okay, I did
I
not
don't
realize.
take any break unless I happen to go on vacation and want a little bit more. But no, that is kind of my maintenance plan, as it were. But it's an indefinite thing without end right now.
How does that make you feel?
When I first, it sounded like I'm tethered to this for my life, but what I realized is I still get a vote. If I wanted to pause for 2 months, I can. But when it's doing as good as it is for me, I'm not going to question, right? But I live a very active and productive life, minus neuropathy and some, other small side effects that it produces for me. I want to really provide that voice that I knew was really important for me, and give people the permission that you do have a voice. I think women, in particularly in medical settings, are not listened to as intently as they might a male counterpart for something they may be doing. And we always seem to want to be more polite, so we're not as, what, you know vehement with our feelings. I don't even want to say pushy, because it's not another negative connotation towards women, but just speaking up and adamantly saying what is happening with us, and that they have the right to do that. You have permission, even in the medical setting. We are the best litmus of what is happening with us that doctors need, even when they don't know they need it, because they are just practicing medicine, and they don't have all of the answers, and we have much of that data is within us. So just helping to teach women that you can be a strong voice at the beginning of your journey, throughout your treatment, post, to your community, to wherever that is, and being able to do that, and helping. I don't know if that is with in different committee groups that doctors may be attending, but encouraging them to just listen more to their patients, and really just bringing that to light a whole lot more.
Are there any moments you can recall along your journey where you had to speak up for yourself and that made a difference in what happened next?
Yeah, no, absolutely. And it actually happened at the first several junctures after my first, in 2020, when we had my radical hysterectomy, and when I was going in for that 6 month CT scan, I was not feeling well, not healing the way I thought that I was viewing others healing, whether that was on YouTube or TikTok or Googling, wherever I was finding other women talking, versus just listening to my doctors who are like kind of poo-pooing me saying, Annie, you just had a major surgery. It takes, 6 to 12 weeks, be patient. But I knew that it was not a healing factor. So that was one where I had to push back. And I was right. There was a small local first recurrence. And then as it happened, the next following year, just 8 months, a few months short of a year, I started losing a ton of weight. And it was like just coming off me, a postmenopausal woman. That is not how it goes. We wish it was, but they were like, Annie, you've been doing so great. And I'm like, something's happening. So I had to be the squeaky wheel. So on those two from a medical standpoint, but I had it several times on the insurance front. And that is its own hairy, messy, animal. And that it is when you're at your sickest and you have to navigate. And I found an advocate within the billing department of my hospital that had my case that I could call directly. And luckily, the good Lord was looking out because she had to spend hours and hours on a phone with me and end up getting attorneys on the phone because it was over $200,000 that they wanted to send to collections. And if we did not know to push back, go, this is unacceptable, and so many times I could have been, dealing with it had it ever gone to collections. It's much messier. So there's every area of your treatment, you will have to find a voice.
Okay, so I am definitely hearing that to me, this feels very important. The advocating for yourself to get the
Yes,
best treatment
yes,
out there and not to be afraid to ask the questions, those kinds of things.
right.
What is your personal mission when it comes to patient advocacy? Do you have any specific?
One of my missions, I would say, knowing how to advocate for yourself and knowing your research and knowing where to go in
Mhm.
different ways to get information so that you're not tentative and worrisome about your next treatment. When I looked at clinical trials for advanced cervical cancer, there was nothing not out of phase one. So there weren't a lot of options for clinical trials without not, being maybe the guinea pig and not getting the drug. So it was very worrisome at the limited number of research in on the advanced cervical cancer.
Yes, the advanced research for advanced cervical cancer is definitely something that you can champion
Yeah.
and that you do champion.
Yeah.
I'd like to talk a little bit about the patient community. Do you feel that now you are like a part of this bigger community that you can tap into? Because a lot of advocacy is about community mobilization, of people with similar experiences. Do you have any experience with that?
Um, I I'm just starting to do that now that I've been on this targeted therapy drug. It was hard because I was such a good primary caretaker for my husband in this last 2 years. So now that I'm on the other side and I have all of this time, I am trying to fill that time with purpose. I go to Colorado Gynecological Cancer. They have their Jody's race every year. I've been doing that for 15 years. So we've always been a community of support. Now I'm a survivor, so I wear a different, t-shirt on that. But in regards to talking with my community one on one, when I got so much out of doing it at my the conference for my drug team, I did not understand how profoundly this could change me. And if it was changing me, then how could I do that with other people?
Tell me about that experience with
Um,
the sharing your story there.
It was the most surreal thing. I was like in a time warp. If you imagine your life kind of flashing before you, from diagnosis to everything I just shared with, came back, no hope, came back. In spite of it all, I was still here. And then I just kind of woke up and I was on stage giving a talk. I'm like, how did I get here? And I'm alive and well. And it was just like, I could just feel like healing happening in my body spiritually. And all of my emotions like caught up all at once, going, Annie, you're being used as a tool for something greater. And if God saved you and this drug is working for you, you are compelled to share this story and make a difference. And in doing that, I could look in the eyes of everybody in the audience and I felt so validated. And it just, that was bouncing back between us. And I had no idea what that would create for hope for me, and a very profound need to pay it forward.
Who would you like to call on?
Yeah, I would like to call on fellow cancer survivors, whether they're currently inpatient or they're past, right, their current treatment. But I would like to call on them. I would like to call on my care team, my doctors, family, and friends who understand the journey that they've been watching others go through, that can help to bring a rally cry to what needs to happen, and to make sure that we collectively have a voice when we can on ourselves, but for others when they can't for themselves. And it takes a village, and I want to build a strong team and a light, the lighthouse, that beacon of hope for others, to make sure that we are heard and that we can, hopefully eradicate cervical cancer, but bring down those numbers and bring up awareness around some of the stigmas that unfortunately still are surrounded by this cancer.
Yes, and every voice I think is valuable in this fight. Your voice, the doctor's voice, my voice, even. It's every voice contributing to this goal to eliminate cervical cancer as a public health burden is a part of the puzzle. Mm-hmm. So we have to all stay active, stay on it. So I think the impact that you're going to make in the future is only yet to be realized.
Yeah. From your lips to God's ears. Everyone used to tell me how strong I was, and I'm like, I'm only strong because I have no choice. Everyone is much stronger than they think if they were in the same shoes. You learn that you have a lot more in you that you would ever imagine. When you're fighting for your life, you find a way to dig deep.